Did you know that delayed referrals contribute to avoidable complications and even death in healthcare? And this is preventable if we can understand when to step back and refer. Why is referral important? Referral is important because of patient safety. The patient safety should be our priority and not our pride. Referring a patient is not a sign of weakness or a sign of incompetence. It is a sign that you care enough to prioritize this patient's health above your ego. As a healthcare professional, it is important to know where your limit is. Knowing your limit is professional. When you see that despite your intervention in that case, the patient is not getting better, you have to refer. When you see that the treatment is not aligning with the disease, you need to refer. When you see that this patient requires specialized tests or diagnosis, you refer this patient. As a healthcare professional, the best thing you can do in situations like this is you take the patient details if the patient wants, so that you can follow up to know how the patient is faring. You can't be a hero all the time. So know when this matter has gone beyond where you can intervene, so that this patient can have the maximum care that patient needs and the patient is going to be fine. Remember, healthcare is all about teamwork. It is not about one person trying to be a hero. So when you know your limits, it will help you to know when to refer that patient instead of making the patient waste funds or delay the treatment or even complicate the case. And in most times, when a life is lost, that life cannot be recovered. Even though funds can be recovered, lives cannot be recovered. So referral is important. Once you know your limits and you know that you can handle the situation, just refer that patient and follow up if need be.